Health Minister Dr. Zweli Mkhize says that South Africa has reported fewer than expected coronavirus cases in its move to level 1 of the lockdown. He, however, cautions that the country is still at risk of a second surge in cases. It says the total of new cases now sits at 1,662. This is in the last 24 hours based on the statistics coming out of the health department. Well, let's find out how worried we should be about the second wave. I'm joined by Professor Salim Abdul Karim. Professor Karim, it's a pleasure to have you with us tonight. When having this conversation around the second wave, of course, there are comparisons between South Africa and what has happened globally in Europe, in the US. Is it comparing apples with apples?
Yeah, I think to some extent, although the situation here obviously is different. So I think as we look at the global situation, we now have a clearer understanding that about 120 countries throughout the world have had a first wave. And of those, just over half of them have already started their second wave. It looks like that the time difference from the end of the first wave to the beginning of the second wave is around 55 days on average. Now, it's not sure whether, it's not clear whether we will follow those averages, but it's just to give us some idea about the way things are looking like in the rest of the world. So there's a reasonable likelihood that we will have a second wave, and it looks like that second wave is influenced quite substantially by complacency and by people becoming weary of their wearing of masks and maintaining social distance. And as they begin to follow those rules less and less, that's when the virus pounces and comes back.
Are those the trends that are being picked up, in particular amongst the countries that are experiencing a second surge of cases?
Yeah, so the second surge has been ascribed to a range of different things. Three things have become the most important. The first is that people just started using their prevention less. The second has been that in some countries, like South Korea, there were outbreaks that occurred in mass gatherings and then became very difficult to control them. And so it went out of control and then they had to be brought back into control. We're seeing a bit of those kinds of things recently with the outbreak at the Tin Roof nightclub. It's a recent situation at Fort Hare University where the students went and had a party at the tavern. So we're beginning to see those kinds of things in this country. And then the third thing that has impacted the second wave in Europe particularly, especially in countries like Spain, is that they rushed to ease their restrictions quickly because they wanted to catch the economic boom that they get in the summer when the British tourists come to Spain. And so what happened was the British came with more than just the plans of having a vacation. They brought the virus with them. And so the virus started spreading again in Spain. And Spain's second wave is really awful. It's much, much worse than their first wave. So it seems that those three things are important. And the corollary for us is that we have bits of those three things already occurring in our country. So that's a source of concern.
So it requires a lot more circumspection from policymakers, but also from South Africans when it comes to changing our own behavior of the extent to which we feel we may or may not be at risk to COVID-19. Has the situation changed at all for health workers under lockdown level 1 and those who are still treating patients who are getting infected with COVID-19?
Yeah, I think we expected that when we completed the first wave, that we would not be in a situation that we would have no cases. So we were expecting to have, a sort of low level of transmission, and that's occurred in many countries. Very few have had no cases at all. I mean, New Zealand being an exception to that, of course. But when we look at the number of cases we get each day, it ranges from between 2 and 3 cases per 100,000 population. So that puts us in a situation where we're seeing between 1,000 to around 1,500, just over that on average per day. So that means we're still seeing patients being admitted to hospital, we're still seeing deaths occur. So the epidemic is still around. I mean, we are in the midst of an epidemic still. But people need to be understanding of that. And it's up to us. I mean, we will define, each of us will define whether we will have a second wave or not.
Professor Karim, do you get a sense that health workers are better protected now than they were during the peak of this virus? And I know that experiences will differ sometimes from one facility to the other, but there, of course, have been general concerns around PPE and the quality of PPE that was given to some health workers.
Absolutely. It was just shameful to see that healthcare workers who are putting themselves at risk, who are being subjected to substandard PPE. I think, fortunately, a lot of that has been addressed, although it's still ongoing. And when we look at the situation, not just in our country, in several countries, that healthcare workers get better with time in terms of using PPE, learning how to manage their daily routines using PPE, especially when they're using N95 masks, which is quite an uncomfortable mask to wear. Overall, we have seen a steady decline in the number of healthcare workers who are reporting positive. That might be because many of them have already become infected in the past and so have some degree of immunity, but it also reflects that there is more diligence when it comes to PPE. So I think it's a combination of those things.
You're somebody who's had great influence in the local medical fraternity and, of course, internationally as well. What do you make of the fact that the majority of companies that were used by different provinces to procure PPE are not even recognized or given the stamp of approval by the professional bodies that, of course, govern what must go into personal protective equipment?
I think at its most fundamental, government has to have some process by which it determines who meets the criteria for purchasing and who doesn't. And in the past, we'd used an SABS standard. And I think, in an emergency situation, some of those requirements became lax. And I think what we have to do is just make sure that that never recurs, and that local companies are just as good as international companies in many instances. They just have to ensure that they go through the same rigorous requirements for standards that would be met by an organization like the SABS.
Professor Karim, what are the indicators that you're going to be looking at that might perhaps signal the point at which South Africa could well be getting into its second wave, should we get there?
So when we look at the epidemic as a whole, we need to look at it not just in relation to cases only. Cases are an important component of the evidence we look at. But we also want to get some idea about what's happening in terms of admissions and what's happening in terms of the percentage of tests that are positive. So those three indicators together give us a much more complete picture as to what we're looking at. Because the cases vary quite a lot day to day. And that kind of background noise you shouldn't get worried about. Some days it's high, some days it's low. It's not a source of concern because we don't look at it like that. We look at it in 7-day averages. So when you look at a 7-day average, you get a better sense of what the trend is. But when we see the trend going up, as was occurring last week for a bit, then we want to look at, is the percentage of tests that are coming back positive, is that going up? And how much is it going up? And if it's staying fairly stable, then it just means that the extra cases we're getting is just because they are testing more people. As long as the percentage of tests positive is pretty static, then we are less concerned about the fluctuations in the tests. And this is being used by many people. It's not unique to South Africa. In fact, the US their standard bearer is the proportion of tests positive. In our case, we also look at admissions. We have a system established by Dr. Lucille Bloomberg and her colleagues at the NICD that has sentinel hospitals that keep us informed. And if we see a jump in admissions, that's a concern. And so we watch for that as well.
Professor Salim Abdul Karim, let me thank you for your time tonight. He is the co-chair of the Ministerial Advisory Committee on COVID-19.